Thank you so much, Tawana. Well, this morning we're joined with some very special guests from the Greenwood Leflore Hospital, Miss Amber Overstreet and Miss Valerie Mitchell. I don't want to mix those up. That would get me in trouble right there. How are you doing this morning, ladies?
Good. How are you doing?
We're good. You guys are here this morning because May is National Stroke Awareness Month. And you guys are both nurses at the ER and the ICU, correct?
I'm the director of the ER and the ICU at the hospital, and Amber is the charge nurse in ICU.
Fantastic. Being May National Stroke Awareness Month, if somebody's dealing with stroke, you guys were going to tell me a little bit about some complications. Can you talk on that a little bit?
After a stroke, you're looking at really rehab is the main thing that you want to focus on, because you're looking at nutritional problems. There's a risk for aspiration due to not being able to swallow, excess secretions, things like that. You're also looking at mobility issues. Blood clots set up when you're not mobile like you normally would be. Pressure sores can set up if you're not able to move and turn the way that you normally do. Social problems such as, there's a lot of depression involved because you can't move and do the things that you normally do.
Right.
Your speech is also affected as well, so we'll have a speech therapist evaluate your swallowing and your ability to speak afterwards.
Now, when if somebody thinks they're having a stroke, what are some ways that they can recognize, maybe to catch it as early as possible?
There's an acronym that we use called FAST that's easy for the public to use as well. So if you suspect someone is having a stroke, first look at their face. You ask the person to smile. If you see any unevenness or a droop, that's one thing to look for. Okay. Arms, you can put your arms out in front of you. If one falls down to the side, that's one way to assess for a stroke. Speech is another. You just ask them to talk if they can talk at all, and look and see if there's any slurred speech. Ask them to say something simple like, "You can't teach an old dog new tricks." Right. And then time is of the essence. That's the important thing to remember. You need to call 911 and get to the hospital immediately.
FAST. Face, arms,
speech and time.
It's very important for the public to know that you need to know the last normal time that you see the patient. Whether it's you tell them it was at the end of the newscast, they were still normal then, or if they have an exact time.
Somebody who's not had the stroke, who witnessed it.
Right,
yes.
Right. It's very important to know the time.
I think that's a big deal because we don't often think, I saw something happen, that I have a big piece that can play in their recovery. One other thing to talk about is prevention. Is there any ways to prevent this? Are there any things that people can do? What are some things that people can do?
There are changeable and unchangeable risk factors for a stroke. Some things that are unchangeable would be race. African Americans are more at risk. Age, anyone age 55 or over, it doubles every decade of life after 55. Any disease processes that you already have, like diabetes or AFib, which is an irregular heart rhythm, or hypertension, which is high blood pressure, puts you at risk for a stroke. Some changeable things would be diet, exercise. Being inactive is definitely one of the leading risk factors. Tobacco abuse or smoking, you need to quit smoking. Any drug abuse.
Yeah, alcohol, drugs, anything like that. It's very important to go and have checkups because you may not know that you have high blood pressure. Right. If you're not, quote, sick, and you don't go to the doctor, then you have no idea what problems you may have, high cholesterol or high blood pressure, or diabetes for that matter. So that's something that you can control by going to the doctor and having a checkup.
And taking your medications regularly.
Get checked, get moving, follow directions. A lot of the little things, just make sure you take good care of yourself. So thank you guys for being here this morning and informing us. We appreciate it.
Thank you.
We've got more right after this. We'll be right back.
This Defeat Diabetes segment is brought to you by Greenwood Leflore Hospital.